In order to fully understand the arthrokinematics of the knee, we need to do a few things first. We need to identify the two bones that are articulating that make up the tibiofemoral joint, and then we also need to identify the shape of those joint surfaces. So let's look at the two bones that are associated with the tibiofemoral joint first. We have the tibia, and we also have the femur. So we have our tibia here, and we have our femur, okay? So now that we've identified the two bones, let's look at the shape of those joint surfaces. So when we look at the tibia, we see that tibial plateau is nice and concave. It has a nice little dip for those femoral condyles to sit in. When we look at the femur, we can see the shape of those femoral condyles are convex. So, depending on which bone is moving, we can identify the roll and the slide. In an instance, such as a closed chain movement or a squat, the femur is going to be the bone that is moving. So as the femur moves in a posterior direction, we can see the joint surface or those femoral condyles sliding anteriorly. So when the convex surface is moving on a concave surface, we say that the roll and the slide happen in opposite directions. So again, the femur is moving posteriorly, but the joint surface, those femoral condyles, are sliding in an anterior direction. That would be closed chain. In an instance where we start with the femur in this position, we're sitting at the edge of the table and we're performing something like a leg extension exercise or a long arc quad, the femur is fixed, but now the tibia is moving. So in this instance, we have the tibia, which is the concave surface, moving on a convex surface. So as the tibia rolls anteriorly, the joint surface, the tibial plateau, is also gliding in an anterior direction. So for the roll and the slide, those are going to happen in the same direction for open chain knee extension. Let's take a peek at some other examples of this arthrokinematic. So once you have an understanding of the arthrokinematics of the tibiofemoral joint, the next question is, how do we use this in clinical application? So I'm going to show you a few really easy joint mobilizations to help improve your patient's knee flexion or knee extension. So let's start with this position here first. So if somebody comes into clinic and they are lacking knee extension, then this is a really easy joint mobilization to help improve that movement. So the thing that you need to do first is set up your patient with the proper positioning. So we're going to stabilize the tibia, and we're actually going to be mobilizing through the femur. So if I take this femur, I'm stabilizing the tibia, and I drive the femur in a posterior direction towards the table, you can see that the tibia is gliding in an anterior direction, just from me stabilizing the tibia and mobilizing through the femur. So this is going to mimic a knee extension type movement. If I wanted to improve knee flexion, then all I have to do is change the position of this wedge here and stabilize the femur while mobilizing the tibia. So if somebody is dealing with a lack of knee flexion, I can use this joint mobilization. So as the femur is fixed, now my mobilizing force is through the tibia, and you can see that the tibia is gliding in a posterior direction. Just to review what we've learned in this video, we have covered the arthrokinematics of the tibiofemoral joint. We have identified the two bones that are associated with the articulation of the tibiofemoral joint, the femur and the tibia, and we've also identified the shape of those joint surfaces that are articulating with each other. The tibia is going to be concave, and the femoral condyles are going to be convex. Depending on which bone is moving, the tibia or the femur, we can identify the roll and the glide of those motions. So for open chain knee extension, or just open chain movements in general, the tibia is going to be gliding on the femur. So we're going to say that the concave surface is articulating with the convex surface, meaning that the roll and the slide happen in opposite directions. If we use a closed chain activity, such as a squat, the femur, the convex surface, is going to be articulating on the tibia, which is concave. In that instance, we're going to say that the roll and the slide are happening in opposite directions. If you found this video to be helpful, please hit the like button, please share and subscribe to the channel, and we will see you next time for anything related to PT or PTA content. Thank you guys so much. Have a great day.